Hello friends, welcome to Creative Medicine. In this lecture, we will learn about. Hello friends, let us now learn M1, M2, M3, their actions and their agonists and antagonists. M1 acts on CNS and stomach, M2 on heart and M3 remaining like glands, on GIT, on respiratory system, all the other systems. Okay, M1 causes CNS excitation, and on the stomach it causes gastric secretion. On M2 it inhibits the heart. Okay, remaining it increases secretions. It increases peristalsis in the bowel. It increases detrusor contractility and increases micturition. Okay, it causes meiosis through M3. It even causes meiosis by contracting the circular muscles of the iris. So all those. So if you see the agonistic action on M1, agonist is oxotrimorin, and M2 agonist is methacholine, and M3 agonist is bithanacol. It is bithanacol. Okay. Then if you see antagonistic action, M1 antagonist is pyrenzapine. It is pyrenzapine and telenzapine. M1 antagonist is pyrenzapine and telenzapine. M2 antagonist is trimipramine, and M3 antagonist is tolteridone and darifenacin. Okay, thank you for watching. Thank you, and thank you for watching.